Hello, good afternoon, everyone. I'm Alec, and I'm here just to say a quick few words before we begin this afternoon. Thank you to everyone for joining us to learn more about the field trip method of healing as we brought it now to Chicago. We are excited to have you here today to learn about the field of psychedelic medicine at large, the current options in ketamine-assisted therapy, and the healing journeys facilitated at Field Trip Health Chicago. There will be plenty of time for questions to be asked in the question tab near the end of the presentation, and there are currently polls for you to engage us, which will help us learn more about you in the polls tab. I want to extend a very warm welcome to Dr. Ben Medrano, the Medical Director of Field Trip Health America, who will take you through a comprehensive overview on the field of psychedelic medicine. And I want to also introduce Judy Seals, our Clinical Director and Nurse Practitioner in Chicago, who will tell you a little bit more about the specific center itself and to walk you through the ketamine-assisted modality of healing.
Okay. Well, thank you, Alec, for that introduction. See if we get the slides pulled up here. All right. Okay, so welcome, everybody. I'm Dr. Ben Medrano. I'm a psychiatrist by training. I trained at University of Colorado and did my residency here in New York City in the Mount Sinai Hospital System, board certified in psych. I also have special training in community psych in the urban underserved. So very passionate about working with issues around access and also for outreach. These have been lifelong interests of mine, but also so have psychedelics and so has consciousness. So that's why I'm here today speaking to you. I want to just give an added special greeting to all you people in Chicago. I'm actually a native Chicagoan as well, even though I'm out here in New York City now, but grew up in Rogers Park and spent a lot of time there. So I have a special sort of heartwarming feeling when I think of all of you out there, and also think of all of you who are doing important work in mental health care there. So thank you all for joining us today. So we're going to start out, let me just give you a little rundown of what we're going to cover. We're going to start by talking about, well, what is a psychedelic and why are we talking about it now? We'll also go into a little bit about the structure of what it is that we do with psychedelics. We'll talk a little bit about the scope of the issue, as well as what we do with ketamine in particular. I think that's when I'll pass it over to Judy. And then also what we're looking at into the future, both as Field Trip as a company and also the field of psychedelics as a whole. All right. So I don't think this word is new to anybody here at this point, but I think it's helpful to actually talk about the roots of this word, what it means, because it gives us a frame as to how we view it as a tool in therapy. So the word psychedelic is derived from the Latin of psyche and delune. These are described as, or defined as mind manifesting. Well, what does that mean, mind manifesting? Now, this could mean all kinds of things, but within the psychedelic community, I like to think of one way of describing psychedelics by some of the founders of this kind of therapy, and that is as a non-specific amplifier. So I like that term because what we're talking about is very neutral in a way, right? When we say non-specific amplifier, what are we amplifying? And when we say non-specific, it means there's no specific thing that we're focusing on while we're doing this. When we give a tool of a psychedelic, we see that whatever is occurring in the realm of the mind, whether it be through the five senses or internally, like through our own thought process, or even in the dynamic in the room with the therapist, that all of these things could be amplified in a way that, say, for example, you're in a party, it could go either good or bad because it's not quite a controlled setting. But in the case of what we're doing, we try to take into account that non-specific quality. Also, when we're thinking about, a psychedelic journey, some people, trip, like our name, a psychedelic trip, it's important to remember that, based on the fact that these medicines are non-specific, that there's no one trip that is the same as another. And this is pretty much determined by the mindset going into doing this work and the setting in which you're doing it. So we actually call that set and setting. You'll hear those words come up again and again if you decide to dive into this work yourself, either as a therapist or as a client. And these are important terms because this is really what we focus on here at Field Trip in terms of optimizing both set and setting. Now, some common themes that you see occur in psychedelic journeys are, like rebirth, near-death experiences, out-of-body experiences. It's really, fair game. Anything's fair game because, again, the mind manifests in its own way, and it manifests in a way that is useful to you in terms of your intention and growth. All right. So what we're talking about right now, and I mean, I'm going to come back to this at another point, but we're talking about a bit of a shift in our approach, how we approach mental health. And in particular, what we're doing is using these tools like ketamine to access state areas of the mind that are sometimes difficult to access in talk therapy alone. And I often get asked, what is ketamine doing in particular? And I think we'll be able to talk about it from a medical perspective, but I think it helps to talk about the feeling of ketamine. And so I'm going to share a little bit about myself and my own experience with that. So back in my old days in Chicago, so this was back in the early 90s, I actually was going through my own process personally in my teens of really trying to make sense of a lot of painful things that had occurred in my life. I grown up in a bit of a chaotic household, surrounded by a lot of different mental health challenges. And I had firsthand experience with trauma. I also had firsthand experience with members of my family suffering from substance use disorders, as well as actual depression, anxiety, and even within my step family, schizoaffective disorder or bipolar disorder. And in the course of growing up, I've actually lost family members to mental illness. And so I know very deeply what it feels like to try to navigate this system, not only navigate the experience of mental health challenges within the household, but also just navigating the mental health care system and all the treatments that come along with it, and the treatment as usual. Back in the early 90s this was a time where the rave scene was really booming in Chicago, and so I found myself in that realm, in that scene, and I had sort of stumbled into that scene as a spiritual kid. I had grown up very, very devout to the religion that my parents had taught me, but I saw some limitations to that, and that led me to explore consciousness because I felt there was more to discover about the self and about making meaning in life. Through my explorations as a psychonaut in my teens, I eventually found myself wanting to learn a little bit more about tools that I could bring to my life. And that led me to Buddhism and meditation. And I spent many years learning and teaching Buddhism and meditation to others, but eventually found myself coming back to science and wanting to figure out a way where I could synthesize these lessons that I'd learned in my life and the tools that I had gained. And that led me into mental health and back here at Field Trip. So I have a very intimate connection with all of the topics that we're talking about today, and just thought I should share that. But I think at one point that I didn't get to touch on is what is the experience of ketamine like? And I think maybe I'll save that for a little bit further if we have some time. So, so on to the next slide. Why are we talking about this now? Well, to put it simply, the treatments that we're using right now are not quite adding up to what we had hoped. I think when antidepressants first came on the scene years ago, we thought that we had maybe found the main thing that was going to help us with depression and anxiety and so on. But unfortunately, over time, we're seeing that those hopes are falling through the cracks, as you can see here. When we prescribe an antidepressant, the majority of those people actually are not taking them, and there's a variety of reasons for that. One being side effects, two being just the experience of it just not working for people. And then we also see, whether you're taking it or not, people are finding themselves relapsing back into depression. It's not uncommon for people who go through this process of trying to find the right medication for them to try multiple medications and still be increasingly disappointed. The reality is most people drop out after a couple trials, and if they go further, it's diminishing returns. And those who continue and get some benefit suffer through the side effects. Most people who take antidepressants have some very common side effects like, GI upset, like stomach upset, and sexual dysfunction is actually one of the most common. And so it's not surprising to see people fall away from the treatment and start looking for other alternatives. So where does that leave us? And on to the next slide. Where does that leave us? So, what we're talking about here, when we talk about psychedelic-assisted therapies and ketamine in particular, we're talking about these big ones right here: major depressive disorder, treatment-resistant depression, and post-traumatic stress disorder, eating disorders, and I had mentioned anxiety as well. The reality is all of the standard of care that we're using right now is not fully addressing these issues. It's now common knowledge to mental health care providers and public health specialists that these disorders, depression in particular, is now reaching the top of the list of one of the most major causes of disability globally. We're talking about hundreds of millions of people suffering and still not getting satisfactory treatment. Especially when we talk about treatment-resistant depression, which means that they've tried at least 2 or more medications, or electroconvulsive therapy, or transmagnetic stimulation. They've tried all of these treatments and are still getting suboptimal results or no help whatsoever. And so that's why we're here. I'm going to pause for a second. And as I'm looking at this slide, now I'm thinking of a ketamine experience that I had later in life. So after completing med school and going through residency, near the end of my residency, I started to hear about the research around ketamine and psychedelics, and found myself curious, but not only curious about it, but I was also going through my own stress of being a resident physician. It's tough training, as well as difficult memories. And when I combine these things, I realized, well, maybe it might not be a bad idea for me to try what this therapy is like. And so I actually went to a physician and went through the process of ketamine-assisted therapy myself. So a little bit about that experience. Well, one, it had been many, many years since I had tried a psychedelic, and I found myself rather surprised by the psychedelic properties of ketamine. I had tried ketamine back in my teens, and I didn't find it so remarkable at the time, but depending on the amount and the route of delivery of which you get ketamine, it is quite psychedelic, I can assure you. In one particular experience, I found myself becoming a tree, and this still sticks with me to this day as I contemplate this experience of a tree in this desert landscape reaching deep down into the dry soil to find nourishment, simultaneously reaching up into the heavens towards the sun to get further nourishment and growth. And it was more than just this concept or sort of a image in my mind. It was an actual feeling that still sticks with me today. And so sometimes when I find myself struggling or feeling stuck, I will remind myself of this memory, and it's been therapeutic to me since. So maybe we could pause for a moment, see if there's any questions, and go from there. If Alec could pop back on. There, Alec. All right. Well, I'm not seeing Alec here, so in order to moderate, I think what we'll do is we'll save the questions for a little bit later, and I'll jump on to the next slide here. So my apologies there of those of you itching to ask some questions, but we'll keep moving, and there'll be some time at the end once we figure this out. All right, so on to the next slide. Okay, so some of you may remember, I talked a little bit about my experience of my brain on drugs. You may remember this slide, this public service announcement back from the 80s. This was a byproduct of the Nixon and Reagan era war on drugs that led to sort of mass stigma. It was a very successful campaign. In fact, TV Guide named it one of the top 100 television advertisements of all time. And that's actually sort of terrifying, because when one asks oneself, well, if we've had these tools for so long, why am I just hearing about it now? Well, this is part of the reason why. Maybe not so much this one commercial, but the war on drugs and the stigma that it produced. I think that it's helpful to reflect that war on drugs has actually turned into contributed to mass incarceration, structural racism, poverty, and social stigma. I mean, we're still feeling the consequences of this today. And it's sad, but it is the reality that we're in. And so I hope through educating you today, we might begin to reverse some of that damage there. And going on to the next slide. So here's an interesting image. I'll try to explain this. This is actually a more accurate way to say this is your brain on drugs. So this was taken from a study of brain imaging and mapping out the mind and interconnectivity. So if you look here on the left, you see this colorful table with lines going from one side to the next. Those sides actually represent processing areas within the brain and connections between the two. So like, let's say, for example, this probably isn't going to be accurate, but let's say the green zone is a sense percepting zone, like say like the temporal lobe listening to sound. And then over on the right, you have a memory processing unit saying, oh, that sound reminds me of an old childhood memory. Now over on the right with psilocybin, so that's the active molecule in psychedelic mushrooms, we see here that there's connections all over the place. So let's go back to, say, the auditory processing unit, and now it's branching over to, say, a taste processing unit where you're tasting sounds. So now you have synesthesia. But also you may have connectivity from memory to other areas of the mind that you might not have normally had. And so what it says to me is it's a profound potential for creativity. Creativity in terms of ways that we think about ourselves, like ways that we think about our depression, or how we may be thinking about a painful trauma or something that may still haunt us to this day. So it shows great potential in that regard. All right, on to the next slide. So actually, as I'm looking at this image, I'm thinking back to my rave days. I think it's helpful to contemplate that, again, setting does play a major role. And I'm not here to judge about what the one right way to do psychedelics is. I think there maybe is a place for it in these kinds of settings, but I'm more of a proponent for using psychedelics in the clinical setting for a variety of reasons. And I think some of them may be obvious to you, but just imagine being at this dance party and you might not like the song, and then all of a sudden you might not like the dance partner that you've paired up with, and you find yourself having actually an extraordinarily disturbing time. Now, so it's my hope, and the kind of work that we do here is that we could limit the potential for those kinds of things from taking place, and use these tools for something deeper than maybe just enjoyment. I mean, I think enjoyment is a helpful part of the healing process, but this is really part of what we're presenting here, is presenting a healing setting. And as you can see here, this is one of our employees, Brandon, who actually helped draw up the white paper, which may be accessible to some of you. The white paper is a bit of an overview of what we do and why we're doing it. And here you see Brandon in his chair, in a zero gravity chair with his noise canceling headphones, as well as his blackout eye shades. And I'm sure you can't see the therapist in the room, but I'm sure that therapist is nearby, ready to lend a holding hand, and also doing what they do best, which is what we call holding space. And that's creating a safe container for people to actually process what it is that they need to learn and grow. And that's a far cry from the strobe lights and lasers and booming speakers. All right, so pause again and just reflect on everything that we've covered so far. You might find it quite remarkable that what we're proposing here is a major shift in mental health care. We're going from this old model of something of a person like myself in a little office, very quickly doing 15-minute med management visits and asking you if you're suicidal and then doling out antidepressant. We're veering away from that model to a more comprehensive approach where we're really taking time to understand what it is that brought you here, and diving deeper with the tools of these mind-altering substances, well, ketamine in particular, to see if we might be able to get past some of those stuck places that people have found themselves in therapy or in other treatments that they've explored. Maybe if we could see if there are any other questions at this point, and see if we've figured out the interface here.
Thank you very much, Dr. Medrano. That was a really comprehensive, informative, and very easy to listen to overview of the psychedelic medicine field. I do think that there are some questions that, why don't we save those for the end? I'm actually going to invite Judy, our clinical director in Chicago, back on to take the baton over from here and tell the audience about what it's like to embark on a field trip health journey in Chicago. And then at the very end, we have all sorts of time for questions.
Wonderful.
Thank you.
Okay.
So thank you, everyone, again. We're really happy that you're here, and I am excited to be joined by Judy, our clinical director in Chicago.
Thank you, Alec. Thank you, Dr. Medrano. I'm happy to be here with all of you and everyone who's joining us live this afternoon. Just a little bit about myself before we get started with the next portion of the webinar. I've been a nurse practitioner for 17 years. My primary background is in cardiology, which I did for 15 years. I also have experience in retail health, plastic surgery, and regenerative medicine. I joined Field Trip Health this past winter, and I'm excited to be a part of something so groundbreaking, and I feel honored to be pioneering this treatment model in Chicago, especially now when the mental health crisis is at an all-time high and more effective treatments are needed. I'd like to take some time to talk about what we're doing at Field Trip Health and why what we offer is so unique compared to the options that currently exist in Chicago for private outpatient mental health care. Next slide. Ketamine is the psychedelic drug that we use in our clinic. It was first approved by the FDA in 1970, and originally it was marketed as a safer alternative to existing anesthetics. Most anesthetics suppress breathing, but ketamine is special in that it doesn't cause respiratory depression. It has a very safe safety profile, and it's used a lot in the emergency room, especially in children and in the elderly as anesthesia. About 20 years ago, it was discovered to have antidepressant effects. Compared to traditional antidepressant medications like SSRIs, ketamine is remarkably effective. SSRIs typically require weeks of continual exposure in order to achieve an antidepressant response, but ketamine has been shown to have antidepressant response within just 2 hours of administration, and these effects can last for up to 2 weeks following just one dose. A third of patients who have depression also have treatment-resistant depression, and they don't respond to traditional antidepressants. In patients with treatment-resistant depression, studies have shown that over 70% of those will respond positively to ketamine after just one infusion. Ketamine works on many areas of the brain. It works on a whole host of neurotransmitters, such as serotonin and dopamine, but the predominant neurotransmitter that it works on is glutamate, and glutamate is by far the most abundant molecule in the brain and nervous system. Glutamate is responsible for sending signals between nerve cells, and it plays an important role in learning and memory. And the way that ketamine works is that it allows for temporary dissociation. It allows one to disconnect from their normal ways of thinking, and this hour-long break or timeout from usual thought pattern is therapeutic. It's incredibly therapeutic, especially for individuals who suffer from conditions like severe depression and anxiety. But it's really what happens in the next few days and weeks when the brain has enhanced neuroplasticity and when it's open to changes in thought pattern and the development of new insights and perspectives that is critical for determining long-term outcomes. And this is why it's so important to couple psychedelic drugs with psychotherapy, and why using psychedelic drugs without psychotherapy is a huge missed opportunity. So what we're doing at Field Trip is a ketamine-assisted psychotherapy approach. In our program, we're using psychedelic drugs to open up our clients' minds, and with therapy, we're helping them to access their own inner healer. This is an active approach compared to a biomedical approach, which is passive in nature. In the biomedical approach, the patient receives an infusion of ketamine, usually over 40 minutes or so. There's no therapy, no coaching, no transformational experience, no psychedelic state. And actually, as a matter of fact, the psychedelic experience is considered a negative side effect in the biomedical model, and dissociation is actually intentionally avoided. With the ketamine-assisted psychotherapy approach that we do at Field Trip, we're incorporating psychotherapy into the use of psychedelic drugs to optimize the benefits of ketamine. Studies have actually shown that increased dissociation is correlated to clinical outcomes, and so it's thought that it may be a necessary component to maximize the results of the ketamine. So we don't shy away from dissociation. We work with our patients, we listen to them and their experiences, and we target peak experiences for each individual patient at each session. In our program, patients receive an intramuscular injection of ketamine. The ketamine psychedelic experience typically lasts about 40 to 70 minutes or so, and there's a psychotherapist there with the patient the entire time, facilitating their journey and being a grounding presence. Set and setting, with set being mindset and setting being the environment, is a very important concept that's not discussed much in medicine. Dr. Medrano referred to it earlier in his portion of the webinar. But this is basically the idea that the same person can respond very differently to the exact same medication at the exact same dose, depending on what their mindset is and the environment they're in. And the reason this happens is because altered states of consciousness are characterized by heightened internal and external environmental sensitivity. You'll see in later slides that we kept this concept of set and setting in mind when we designed our treatment program and our clinic spaces. So our ketamine-assisted psychotherapy approach is delivered typically by 1 to 2 preparatory psychotherapy sessions, 6 ketamine sessions, and 4 to 6 integration sessions, depending on the program that the patient's in. The goal of the prep sessions is to determine the patient's readiness for change, their openness to changing thought patterns, and their ability to access their inner wisdom. The ketamine sessions are usually twice a week over the course of 3 weeks, and during these sessions, our goal is to administer the psychedelic medication and to create an experience for the patient while controlling the setting. The integration sessions, now that's where the magic really happens. This is when the client and therapist discuss the material that was uncovered during the exploration session, and they determine what the learning opportunities are and how the client can make meaningful changes in their daily life. So the integration therapy session is really the key to the program. It's what helps the patient understand the experience, and it's what facilitates long-lasting, meaningful change so that they can lead better lives. So you can see that the difference between the ketamine-assisted psychotherapy approach that we're offering is that it's a very active approach. It leads the patient through emotional breakthroughs, and it helps them to process and actively engage and transform so that they can heal, whereas the biomedical approach is a more passive approach. Next slide. So there's data that shows that ketamine is effective in treatment-resistant depression. This particular slide is a graph depicting the efficacy of twice-weekly dosing. researchers in 2012 demonstrated that there was strong efficacy in twice-weekly dosing over 3 weeks in treatment-resistant depression. The red line is the placebo. The bottom blue line represents the patients who were treated with ketamine. And what they found is that nearly 70% of patients received a positive response that started almost immediately. You can notice it more at day 4, and that positive response was still evidenced by day 15. The patients had clinically significant changes in their depression scores, and they tolerated the drug with mostly only minor side effects, things like headache, nausea, and dizziness. And it's not shown on this graph here, but there was also a meta-analysis that was done that found that a single administration of ketamine reduced suicidal ideation in over 50% of patients immediately after dosing, compared to about 20% in the control group. And those positive effects were still present 1 week later. So you can really see the tremendous benefit that patients with treatment-resistant depression, suicidal ideation, and conditions like that, and how they can benefit from the ketamine. So I want to walk you through each step of one of our main programs, the core program, so that you can understand what the client's journey looks like. First, the patient receives an appointment for a psychiatric consultation. This is done virtually. Actually, the first 3 steps that you see here are going to be done virtually. The psychiatric consultation is done by a psychiatrist or psychiatric mental health nurse practitioner. And during that visit, they review the psychiatric history and the medical history and screen for any medical contraindications and determine if the patient is going to be a good fit for our program. So if they are, then the second step is to have a psychotherapy intake with one of our psychotherapists. And this is when the client meets the psychotherapist, and that visit allows the 2 of them to get to know each other and to understand the motivations and intentions for seeking treatment. After the psychotherapy intake is the preparatory component, and that is designed to help prepare the client for their initial ketamine experience. It's an opportunity for the client to explore their thoughts and feelings and hopes and concerns around it, and to get all their questions answered. Usually about 1 to 2 or 3 days after the prep session, the client has their first ketamine exploratory session. And the ketamine sessions usually last about 2 to 2.5 hours. It consists of a check-in with the therapist and the dosing and medication administration with the nurse practitioner. The effects of the medication last about 40 to 70 minutes, and the therapist is present during the entire journey to facilitate the process and to be a grounding presence for the client. After the psychedelic exploratory session, there's a brief integration session with the therapist to help process that experience. And after the ketamine session is completed, the patient is invited to relax in our integration lounge, where they can have refreshments, journal, and reflect on the experience. We also have art supplies that our registered art therapist has carefully selected for clients to use in that space. It's not depicted on this graphic, but in Chicago, we have 4 integration sessions total, and not the 3 that are shown here. Our 4th integration session is actually in between that first and second ketamine session. And so there are a total of 4. But the integration sessions are where the transformation occurs. It's a container to process emotions and insights that may have arisen during or after the ketamine exploratory session. Our therapists use client-centered, evidence-informed approaches specific to the client's needs, such as cognitive behavioral therapy, motivational interviewing, and behavioral activation. And you can see that the treatment block repeats itself twice. So there's a total of the 6 ketamine exploration sessions and 4 integration sessions over the course of 3 weeks or so. During the program, patients are sent standardized clinical questionnaires, and we use these to measure the treatment progress and clinical outcomes. They also have access to the Field Trip Health patient portal, and that has mindfulness tools, therapeutic exercises, mood tracking, and other educational content that they can use to help build coping skills and to integrate their insights. After they complete their treatment program, they're in what we refer to as the beyond phase of their treatment. And Field Trip is deeply committed to sustained mental well-being. And after treatment with us, patients continue to have access to digital tools, educational materials, and active treatment modules that can help to potentiate the benefits of the ketamine-assisted psychotherapy. We also have protocols for maintenance sessions, and if patients feel that this is something that they need, they're welcome to return for future ketamine sessions and integration therapy if it's indicated, and if our clinical team deems that it's necessary. So the next slide shows the results of the self-assessments that I referred to previously. And all patients who are in our program complete this at different stages of the treatment program, the beginning, the middle, the end. And this is in all field trip health centers, not just Chicago. These questionnaires measure depression, anxiety, and trauma symptoms, and they're created by medical professionals and used in clinics around the world to determine outcomes of various treatments. In this graphic here, you can see the general downward trend in all three of the assessed areas, which is indicative of the efficacy of our treatment. Patients are starting their field trip health ketamine-assisted psychotherapy treatment programs with moderate to severe depression and anxiety and high trauma scores, and they're exiting our program with lower trauma scores and feeling significantly less anxious and depressed than they did at the beginning. The next slide is at the 1 month mark. And at the 1 month mark, we're still observing that patients still have the lower trauma scores and the mild depression and anxiety symptoms that they exhibited right when they completed the program. So I'm so excited that we've launched in Chicago and that we're able to offer this treatment option to clients in Chicagoland. The next slide is of our clinic, and you can see what a beautiful space it is. It's very warm and open. Our facilities are rooted in nature, and they're designed to make patients feel like they're in a different space immediately upon entry. The design also invokes feelings of safety and comfort. It's a modernistic design with natural elements like the living moss wall that you can see in that middle picture. And not shown are our treatment rooms, but all of the treatment rooms are spacious and bright and airy. They all have zero gravity chairs. We put weighted blankets, eye mask, and noise canceling headphones on the patients during their ketamine sessions, and we play music from a specially curated playlist to move them through their journeys. The picture on that far left is the entry to our integration lounge, and this is where we invite patients to relax after their ketamine session is ended. There, they can meditate and journal and reflect on what they experienced during the session. The Chicago team is made up of a group of very talented and skilled individuals with many years of experience. We're all passionate about psychedelic-assisted psychotherapy, mental wellness, and inner healing practices. You'll find that we all have a personal connection to psychedelic medicine because of our own psycho-spiritual growth and journeys. We provide care through a trauma-informed lens, and our therapists have extensive experience in crisis intervention and treating a multitude of conditions. The feedback from our clients that we treated has been overwhelmingly positive. Ketamine-enhanced psychotherapy allows patients to more fully engage in the therapeutic process. And our therapists are witnessing that patients are able to have a sense of belonging and attunement that can be difficult to achieve in ordinary states of consciousness. Remarkable changes in mindset and behavior are being made. And what patients are experiencing has been nothing less or nothing short of life-changing. We're helping patients to feel more alive and to have hope, and overall just feel better than they have in a long time. And so I just want to reiterate that it's such an honor to be doing this work and to be alleviating the suffering that so many people are experiencing right now. We're so glad to be here in Chicago offering the service, and we're glad that you joined us live today to learn more. So I wanted to just open it up for questions or hand it back over to our moderator.
Thank you so much, Judy. That was really eye-opening, and I'm really happy that you were able to share such a detailed overview of what goes on behind the scenes, behind the walls of the of our psychedelic clinic in Chicago. I'm now going to invite Dr. Ben Medrano back on stage, and I will be asking both of you questions that have come in from the audience. If anyone has any questions, please do not hesitate to ask them in the questions tab, as that is where we will be seeing them. And if you have any questions for us, please send us an email, chicago@fieldtriphealth.com. You can find us on any social media at @fieldtriphealth. That's our handles across the board on Instagram, Twitter, Facebook, and LinkedIn. Or please visit our website anytime at fieldtriphealth.com. So now, let's get right into it. The first question, I think, comes from Patrick Biller. I think it's a great question, and I think it's very pertinent for the subject matter. I've tried every possible treatment for chronic generalized anxiety with no positive results. I'm sure you hear this a lot, but I'm terrified of having a bad trip, but really want to try this program. Are most people scared? Dr. Medrano, what do you think first?
Well, first, my heart goes out to you, Patrick. I hear this a lot, and actually that's why we're doing this work. So it's a great question. Now, when it comes to anxiety and psychedelics, it's probably intuitive to most people here, and it's already been alluded to in Patrick's question, is that it's scary when we have an alteration in consciousness, especially if that's unfamiliar to you. That's actually common for pretty much everybody. I would say most clients that come through, they're very apprehensive about their first experience. I would say the good news, before diving into more detail, is that the vast majority of them fare well. And for the ones who struggle, eventually they figure out a way in their, following dosing sessions. I mean, our staff is trained specifically on this point. This is what we do. We want for you to feel safe. We want for you to feel comfortable. And we also want for you to go, maybe lean in a little bit to these places that scare you. And it's a big part of growth. And I'd say that a lot of the work that we're doing with psychedelics is what we would call adaptive stress. We're pushing ourselves just a little bit, just like, say, if you're doing like high intensity training, where you're running real quick or doing interval training and then slowing down. I'd like to think of it that way, where we have an opportunity to maybe push ourselves a little bit. And in that process, we apply things like breathing exercises and various other meditative calming techniques. And even the music and the setting that we have is calming for most people. A lot of people, they say when they first come through our doors, they say, actually, I felt better as soon as I walked into the center. And that's very deliberate. We want you to feel that this is a place that is different, say, from your usual approach towards mental health, that you feel refreshed and cared for and connected to nature even. We have a lot of natural tones in our decor. But the reality is that ketamine, unlike other psychedelics, tends to not be as scary. I would say it's mostly a pleasant experience for the vast majority of people that have it. And instead of hearing the words, "Oh, that was bad," or "that was a scary experience," most people come out and they say, at the worst, they say, "That was weird." In fact, I hear that more than anything. "Oh, that was weird." But then people get comfortable with the weirdness and they make use of it.
Thank you. That was awfully insightful. Judy, do you have anything to add?
No, I think what Dr. Medrano said was very accurate about how well trained our therapists are in helping patients feel safe and comfortable. And just to let patients or future clients know that it's really a team approach. We all collaborate, the nurse practitioner, the therapist, along with the patient, to find out what the goals are. And that helps us with our dosing strategies. And we, inquire about past psychedelic experience, and we take that into account. Any anxieties or concerns or hesitations, we also take into account when we're dosing.
Awesome. Well, thank you very much for adding. I think a tangential question that's come up a couple times in the chat here is a point about maybe having to remove antidepressants, the medications from your treatment regimen before embarking on this program. So I wanted your guys' thoughts on maybe how that actually looks and how antidepressant medications and the field trip program interact. Judy, do you have anything you want to start with?
Yeah, so the great thing about ketamine is that it's so safe and there aren't that very many interactions. And we haven't found that we've had to have patients stop any of their traditional medications. We haven't come across that. There are some things that we would like to avoid the day of, if possible. Things like benzodiazepines, muscle relaxants, stimulants, things like that. But we're not asking patients to stop their current treatment plan.
Dr. Medrano, do you have anything to add?
Nope.
Awesome.
That covers it.
That's a very concise answer, Judy. Thank you. We also had a couple of questions in the audience about the dosing of ketamine and how, alongside the administration route, the dosing can vary between patient to patient, how the administration route plays into effect. I know in Canada, where our first Field Trip Health Center was based, we use sublingual lozenges, but in all the American Field Trip Health Centers, we actually use intramuscular injections. So Dr. Medrano, why don't you start us off by talking about both the dosing and the administration route, if that's all right?
Yeah, well, you said part of it there already. So here in the States, we use injections, sort of like a flu shot in the arm, generally is how we administer it. Now, when it comes to dosing, this is where some of the art takes place in this work. I mean, we have some clear guidelines. We try to make it weight-based to a certain extent, but we've come to realize in this work in terms of therapy that what we're shooting for and is a specific kind of window of experience where the client can make use of this alteration of consciousness and specifically towards the goals that they had in their care. So say, for example, somebody has a history of trauma, the experience of beginning to get closer to that, maybe if somebody wants to revisit a traumatic memory and reprocess it, that experience of getting closer to that painful spot might take a little more of a gradual approach, and then we'll use lower doses initially. But for the most part, we're following our client's lead. We give some guidelines about, here's a sort of weight-based range of where you should be right now based on your goals. But in the end, we let them decide. And then we'll give our clinical judgment on top of that. For somebody who's wanting to get, maybe who is struggling more with, say, like an existential depression, or that they have maybe a dense rumination or a thought loop that they've been tormented by for many years. And we'll find that sometimes using higher dosing might be a better target for us. And again, following their lead. We talk about the span of sort of trance-like states to transformational states. And so when you're in the lower doses, it feels a lot more like a meditative experience. And when you get to the higher doses, it can feel very psychedelic or transpersonal. So, yeah.
Yes, thank you. Judy, do you have anything to add to that statement?
Well, I agree with all that, yes. And just to add that there's plenty of time to work on the dosing. We see the patients for 6 encounters, 6 dosing visits, and that first visit is going to really be about establishing safety and sensitivity, because people do respond very differently, depending on their presenting conditions, their past psychedelic history, their overall medical conditions. And so that sensitivity will establish that, and we can find a good working dose, and it's very fluid and flexible. And there definitely is an art, because that patient can have a different response to the same dose on a different day, the exact same dose, which is what we talked about in the presentation, the set and setting. And so after each encounter, we evaluate their physical response to it, to see what side effects or anything like that they're having. We evaluate what type of working material they had, and if it was a productive integration therapy session afterwards, and then just what the goals are going to be for the future sessions. And so it definitely is more of an art than a science, and it's something that we're adjusting and evaluating constantly.
Thank you both. That's a very in-depth answer to the question that doesn't have a very one and done answer. So thank you. We've seen some questions come through about contraindications to the program, as well as other interfering medicines and alternative methods of treatment, such as medical cannabis or other drugs, like how medical cannabis and this ketamine-assisted psychotherapy program that we offer interact. So Judy, do you have a comment about the contraindications, and then maybe specifically about medical cannabis?
So contraindications to the program, younger than 18, we're treating adults only at this time. Weight can be a relative contraindication, especially depending on other comorbidities. So we just look at each individual patient. Any recent symptomatic traumatic brain injury is a contraindication. Personality disorders, we're not really equipped to try to treat that, because this is a very short-term, treatment program, and personality disorders and things like that need just longer-term care. And substance abuse, active substance abuse. So the medical cannabis, as long as it's being used for medical reasons, as long as it's not something that's being abused, we're pretty, I'll say flexible on that, and everyone has some different beliefs around that. In Chicago, our psychiatrist is asking patients to abstain from cannabis use for up to 4 weeks beforehand, which is different than other centers are doing. There's not really a safety concern with it. It's just that the cannabis can blunt the effects of the ketamine, and we want everyone to have as optimal of an experience as possible. So depending on conditions, we're asking patients to abstain for several weeks beforehand, at the minimum, at least 48 hours, and during the course of their treatment. If they're using it for, trauma symptoms, and, severe anxiety, and they're, not able to really function without it, then as needed, they can use it during the treatment program. But if they're able to avoid from it during the treatment program, that is what we ask and prefer.
Dr. Medrano, what say you?
Well, clearly it's a big conversation when we talk about decision making around, who's appropriate for ketamine or not. I would say the good news is that most people, there's usually not that big of an issue. I mean, ketamine is a very safe medication, as we've said before. And the safety profile is one that, so safe that we use it in both the geriatric population, maybe not, and for the adolescent population, we don't use it necessarily in our clinic for therapy, but it's used in operation rooms. And so again, it's an anesthetic. It's being used at actually up to 10 times the doses that we're giving in our clinics, and quite commonly for those populations, and they fare well even with repeat dosing. I think I always frame it as what are the common things that we look at, and what are we mostly screening for? Uncontrolled hypertension or some kind of respiratory compromise, like difficulty with breathing or getting oxygen into your blood. These are the things that we really focus on, because there can be spikes in blood pressure and heart rate. That's pretty common. Those are transitory, don't last very long, and usually not high enough for us to be of concern about. But if you have a history of some uncontrolled disorder relating to those, then we need to talk about getting it under control. It doesn't mean you can't get ketamine. It means we got to get it under control, and then you can come back. Same goes for respiratory issues as well. A lot of those we can actually get under control and treat. Sometimes we can't, but it's rare that we have to screen people out like that.
Thank you, guys. Thank you for your thoughts and comments about the contraindications. We get that question a lot. If anyone would like to learn more about our treatment program and how you can embark on your own healing journey with Field Trip Health, you're more than welcome to book a short free call with one of our team members in order to learn more. If you go to, I'll link this in the chat in a moment, but if you go to fieldtriphealth.com/get-started, there will be someone on the phone who would love to speak with you and to walk you through the contraindications and tell you what it is like to learn or to embark on your own healing journey at Field Trip Health. The next question comes about our modality to this ketamine-assisted therapy, in that, is ketamine treatment, or one module of treatment, sufficient for the treatment of depression at all? What are the benefits of using the modular approach that we do in this cyclical format? Dr. Medrano, why don't you start?
Yeah, well, so the design of frequency of dosing of ketamine is one that's somewhat arbitrary, actually. It was chosen by the researchers, I think going back to 2006 is where a lot of the studies started to create the foundation of saying, oh, we should do 6 dosing sessions over the period of 2 to 3 weeks. I think all clinicians were trained to be as evidence-based as we can. And I very much ascribe to that. And that's part of the rationale towards our treatment model, is to say, look, we've seen lots of repeated studies here that show that if you do the dosing this many times at this frequency, you will get this particular outcome with ketamine alone. Now, what we don't have is a significant amount of research of what if you pair that up with therapy. And I think that's sort of to be continued. We have a lot of work to do on our end to show the benefits of adding therapy to it. I'm trying to remember if the question was asking about just one, what was it about one dosing, if that's sufficient by itself?
One dosing or one cycle or module of our treatment program.
Oh, yeah. So this dives into the topic of needing maintenance doses. So this is actually going into the a bit of the unknown. I mean, there is a little bit of research on maintenance dosing, meaning like having to come back for repeat dosing. We do see that, and a lot of the IV centers see it quite commonly. Actually, it's a built-in part of their income model, is that you're going to have, maybe up to 3/4 of some of these people with very severe treatment-resistant depression needing to come back. And how often at those centers, I hear all kinds of numbers, but usually it sounds somewhere within monthly. When I talk to people who are like-minded, who are doing models like ours, I see that the frequency the frequency or even the amount of maintenance doses becomes less. And that's just intuitive to us. I mean, we're really trying to help people get to the core issue rather than take a Band-Aid approach. And so getting engaged in therapy, doing lifestyle interventions, these are all things that we sort of help with and encourage. And when people do that, we find they need maintenance doses less and less. We don't have a problem with giving maintenance doses if need be. We usually only see it in a minority of patients with treatment resistance and, a lot of medication trials. But yeah, I think that's about it.
Judy, what are your thoughts?
No, I don't have anything to add to that, actually. Yeah, that's all said.
Okay, thank you. And I think the last question that we'll take is something that often comes up when people like those in the audience are very interested in learning more personally about this field is what is the training that you recommend for care practitioners to undergo, to take part in before being prepared well enough to administer this therapy? Judy, why don't you start?
I'm not familiar with any outside training organizations, but I know at Field Trip we have a very thorough, comprehensive onboarding and training process. We also, there's a lot of didactic information, recommended readings, and webinars, podcasts to learn from. We also do experiential trainings in the clinics too, and we have very close supervision program for the therapists when they're onboarding.
Dr.
Medrano, do you have anything to add?
Yeah, I mean, there's sort of two parts to the question, right? Which is, when we say this kind of work, we're talking about working with ketamine, but two, we're talking about psychedelic-assisted therapies. So it depends on what vantage point you're looking at. I mean, if you're a therapist who wants to get into this kind of work, there's a variety of programs, starting with the California Institute of Integral Studies has a certificate program for psychedelic therapy and research. There is, again, from the psychedelic side, there is the Integrative Psychiatry Institute, which is an online program, but based out in Boulder, Colorado, who offers a program on psychedelic-assisted therapies, training again for therapists. They also offer a training course for people interested in doing ketamine-assisted therapy, and primarily for prescribers, MDs and NPs and PAs. There's another company known as Fluence, and Fluence is also an online and / in-person training program that is based out here on the East Coast, and their website is fluence8.com, I believe. So those are sort of the top three I think of. And then there's, one of the sort of godfathers of ketamine-assisted psychotherapy work. His name's Dr. Phil Wolfson. He has a training program called the Ketamine Training Center, and they have experiential trainings as well. There's one more called PRATI, P-R-A-T-I, Psychedelic Research and Training Institute. I believe it's run by Scott Shannon, Dr. Scott Shannon out in Colorado. And they have an experiential ketamine training as well, both for prescribers and therapists alike. As I say all these, I just have to add, I haven't gotten to try all of them. I've tried a good portion of them, and I have good things to say about the people who pretty much are running all of these programs. Most of them are physicians and skilled therapists and people who've been involved in psychedelic research. So, yeah, I mean, it's really up to you and how deep you want to dive into it. And yeah, that's it.
Well, thank you. I do think that is a lovely note to end on. I really appreciate both Judy and Dr. Medrano, both of you, for taking the time out of your very busy days in order to speak with us and me today to dive deep into our healing modality, Field Trip Health. And I want to extend a big thank you to everyone who took time out of their busy days in order to come and hear and ask questions. Thank you so much. If you have any questions further or want to connect with our presenters, please do not hesitate to drop us an email at chicago@fieldtriphealth.com. We would love to speak with you, get some more questions answered, connect with you one-on-one if that's something you'd like to do. We are always here. Our psychedelic medicine modality of healing has just begun, and we are opening Field Trip Health centers like crazy throughout these next couple of years. And so if you aren't in Chicago already, hopefully we can come meet you where you are at soon. And I think that's it from us. Thank you everyone so much for attending, and we look forward to hearing from you.
Take care, everyone. Nice to see you all.